Today on the Nurse Coach Duo, we are interviewing Dr. Hannah Nikolich from B Health in Oak Park, Illinois, and we are talking all things pelvic floor health. We're so excited to have Dr. Hannah on.
Hi, welcome to the Nurse Coach Duo. I am Jen Schroer. I am the owner of Clarity Health and Wellness and one of the coaches of the Nurse Coach Duo.
All right, and I am Coach Angie. I am the owner of Coach Angie. And we are so excited to have Dr. Hannah Nikolich with us today. I have had the pleasure of getting to know Dr. Hannah through her being a guest speaker educator at a menopause education class that I lead here in Oak Park. And so we are delighted to have you on as our first guest of the Nurse Coach Duo. I think Jen and we would agree, or, definitely in our top 5 of important topics for women in midlife is pelvic floor health. So we are so excited to hear from you. And we know our subscribers, viewers are going to learn so much today from you, Hannah. So I'm going to get started with your bio and let everyone know who you are and a little bit, and then we'll get started. All right. So Hannah is a physical therapist who graduated with a Bachelor of Arts in Psychology from Illinois Wesleyan University. Go Titans. Love that. Where she not only excelled academically, but also competed in women's soccer and co-captained her team. She then went on to further her education and pursue her doctorate in physical therapy from Governor's State University College of Health and Human Services. She has experience treating orthopedic conditions for patients of all ages, but her true passion lies in treating women with pelvic floor conditions. Hannah has completed specialty training and education from the Herman and Wallace Pelvic Rehabilitation Institute, making her a go-to expert in treating women with all types of pelvic floor dysfunction. She is also a certified Schroth therapist for treating patients with scoliosis and other spine dysfunctions. She particularly enjoys treating pelvic pain, as well as pregnancy and postpartum conditions. She is currently training for her first Olympic distant triathlon.
Wow.
That's very exciting. Very exciting. Welcome, Hannah.
This is great. I'm excited to be here and talk more about pelvic floor PT and how it affects women and what we can do to help.
Awesome. All right, well, we're going to start off with pretty straightforward questions. What is the pelvic floor, and why is it an essential part of our musculoskeletal system?
Awesome. So I am going to bring over my model here. You let me know if I need to adjust in the camera. Okay. So when I say pelvic floor, we're talking about the bottom part of the pelvis. And so if this was me, I'm going to stand up. This would be where my pelvis sits. And so the pelvic floor makes up the bottom of our pelvis. We have 3 layers of skeletal muscle here. So we have more superficial muscles that are smaller and sphincteric. We have middle layer muscles that run transversely to provide support. If we look down and in, we can appreciate—
That's perfect, Hannah, right there.
Awesome. We can appreciate the deep pelvic floor muscles that go from front to back of the pelvis. They attach at the base of the spine, so they affect our spine position. And they are a quarter of our main core muscles. And we never really talk about this. So that's the part to me that's the essential knowledge, is that a lot of people think the core just means kind of their belly or their abs. Mm-hmm. And our core are the trunk muscles that support our spine and pelvis to keep us upright and strong while we move arms and legs without hopefully falling over. So our pelvic floor is playing a big role in that as part of our musculoskeletal system.
Awesome. Thank you so much for that explanation. Just showing that is really helpful because it really tells you why this is such a problem for so many people. And one thing I would like to just add that, we are talking about midlife women, but this happens with men as well, right? Pelvic floor dysfunction. Totally. So I would love for you to go a little bit deeper and just tell us kind of, as you were kind of showing that, what those common signs of the pelvic floor issues are.
Yeah, so a lot of the things I'll treat, some of them are very direct. So because our pelvic floor muscles have an effect with bowel, bladder, and sexual functioning, kind of dysfunctioning of any of those are things I might treat. So urinary incontinence, urinary urgency frequency, discomfort with urination, and then applying all those to bowel. So fecal urgency, fecal incontinence, or constipation where we're not going frequently enough. And then pelvic pain kind of goes across the board. It can be pain with intercourse. It can be just pelvic pain with daily activities. Sometimes those are related to other diseases like endometriosis and things like that. Sometimes not. And then to a greater extent, because they're part of our core and work with our spinal muscles, women that have hip pain or low back pain sometimes also are having a pelvic floor problem. And so it's really important that I think we need to recognize those signs and symptoms being bowel, bladder, sex, but also can just be pain or dysfunction from an orthopedic perspective as well.
Mm-hmm.
Great point.
Yeah. Why do you think women in midlife struggle with this? Like what happened? What's going on, right? Like, is it, I'm sure I'm sure people, have issues prior to being 40 years old, right? We know that. But, we're hearing from our clients, different symptoms. And I'm just so happy to always have you to send people to. And Coach Jen also has someone in her life as well, which is great to send her clients to. And there's, but what's the unique time? Why all of a sudden?
I think that's a great question. I know we've talked about this, Angie, that there's pelvic floor dysfunction doesn't discriminate. So it could be any age, it could be any gender, it could be if you've had babies or not had babies, right? But I think a lot of factors all accumulate at middle age. A lot of those being changes in activity level, changes in hormones for sure, because estrogen affects the tissue integrity in our perineum and in our pelvic floor muscles. So when we start getting changes in estrogen, that can affect the tissue functioning. I think also, if let's say we have had babies and we start meeting midlife, a lot of times things that happen maybe earlier during delivery weren't always addressed. So if we have scar tissue from tearing, episiotomies, if we had a cesarean delivery, if we had maybe pain or incontinence that didn't really stop us in our tracks at 30, but now is kind of catching up, it's getting worse over time because that problem is sort of persisting and bad habits are setting in. And a lot of women just maybe didn't have the time to fully recover or give themselves the self-care they needed. We're in America, we're not very great at that across the board. And so I think when you hit that middle age time, now you have maybe problems that have persisted that are getting worse over time. A lot of times you have changes in activity. So, maybe you were a runner in your 20s, but, now there might be something else like, you have the start of arthritis or something like that that's stopping you. So that normal physical activity that maybe kept you strong before has changed. And then you're adding hormonal changes that are impairing the tissue integrity. And so it's sort of this trifecta time when like something that maybe was sort of trickling underneath starts to kind of erupt.
Yeah, that's really great information. I really love that you say that it doesn't discriminate. I think that's such a really good classification because you're right. So I don't have children. And so a lot of women think, oh, I haven't gone through that. So why would I have any problems? Well, there's a whole lot of problems, a whole lot of reasons. Like, I was a soccer girl as well, like with just whatever injuries we had going in through, our younger years could definitely affect it. And I really appreciate you bringing up the fact that estrogen matters. So, we deal with we're dealing with women in midlife. Angie and I both coach a lot of women going through perimenopause and menopause. And what they're not understanding, some of them, is that estrogen is anti-inflammatory. So as we lose that estrogen, we start increasing our inflammation in the areas that have been affected that maybe we didn't notice before.
Definitely. And we can start to get some atrophy, right? So when we start getting vaginal atrophy or atrophy of those tissues, because that vaginal canal is sitting surrounded by the pelvic floor muscles, then they start misbehaving because they're not getting, their usual, amount of estrogen and health in the surrounding tissues that they would have been getting as well. So that definitely, to go off on just a little side note, I know I've talked with Angie about it too. Like when I work with women in midlife, one of the things I ask them is if they've been prescribed a vaginal estrogen or if they're using a vaginal estrogen cream at all. Because particularly if they're there for a bladder complaint, I see a lot of overlap with those where their bladder symptoms typically already get a little better if they have some type of estrogen, support or supplement. It makes a big difference.
Yeah, great point. Great point. And I feel like pelvic floor is becoming a little bit more, I don't know if mainstream is the right word, but can you kind of talk to how we can we all three sitting here talking, I think is helping normalize the conversation, but I find that so many women still are so embarrassed to even mention. It's almost like, how we used to we still whisper the word period or whisper the word menopause, or we're like, oh, I go see a pelvic floor. Like this doesn't have to be embarrassing. It's not our fault. So, what are your thoughts around that about how we can continue helping to normalize this conversation?
Yeah, I think this is a great start, right? What I found, I think from the more mainstream aspect is like my postpartum gals, because they're maybe more active on social media. They see pelvic floor therapists on social media. They maybe know about it a little more and they talk about it, I think, more openly with one another. And I think there's a sense of less shame when it's right after a baby versus a problem you've kind of ignored for a long time, but there shouldn't be. That shouldn't be true. Like statistically, 1 in 3 women throughout the lifetime will have some type of pelvic floor muscle dysfunction. So what I tell people is, hey, we know each other, right?
Yeah.
Like we all know each other. And that statistic is probably underreported, to be honest, right? And so it's like, we know each other. We're sisters, we're friends, we're aunts, we're moms, we're daughters. And so having these conversations is so important. And sharing like, hey, I had that too. And this really helped me. Like those are the things that can make a big difference when we, feel comfortable with people that are in your circle to have those conversations. And I always encourage, patients, if they had a good experience working with me and they feel better, I'm always like, go tell someone you know and love. Like tell them that this is a thing and that it's helpful for you, because that's how we start to really normalize that, where it's just, this is a part of our body. That's why I go through the whole model as well. Cause it's like, this is a part of our body that we can't ignore. If my shoulder or back hurt, I'm not going to be embarrassed to tell somebody I'm doing PT to help, myself reach better or style my hair. So it's the same thing. If something isn't working in our body, I think it's important we address it. And when it helps, like if PT helps or whatever, your doctor, your estrogen, whatever it is that helped you, tell people so that they know they don't have to live with uncomfortable symptoms.
Absolutely.
Yeah, the conversation, we just have to keep on talking to each other, right? And
I literally, Angie, my mom died, I think, at my bridal shower that her and her friends threw me when I was about to get married, because, I start, me, I get excited about my work. And so they're asking me, I start jumping into things, and, they were all, around that age having questions. And my mom's over there just like, why are we talking about this? And I'm like, Mom, no, this is great. This is a great shower. This is important. Let's get this information out there.
Meeting all your needs. That's great.
Exactly.
Yeah. Well, I can't help but think about like, the women in midlife that are watching this may think like, oh my gosh, it's, I can't do anything about it now. I had babies years ago and, I did my Kegels and, that's, where I'm headed.
Yes.
But like, we're to this point. I mean, I'm sure you see many great benefits for even the 50, 60, 70-year-old woman
100%.
Coming in, or man, but I know we're primarily talking about women today. But I just kind of want to give that sort of put that out there and for you to confirm that, yes, come in if you're having these different symptoms, despite your age, if you haven't. But I also want to go back to the Kegels. Like, I know I love how you talk about Kegels and how that's what the Gen Xers learned. If you did have a baby, that's what we were left. We were told to start doing Kegels in our pregnancy. And then after, that's the instruction we get, or we got, and thought maybe that was doing, I'm sure it was helping a little bit, hopefully.
Sure.
But
so. Yeah. I think there's 2 things to address there. I think the first is like, I truly treat across the ages. And it's never too late. Is it ever too late for us to take care of ourselves, to feel better, to address things that are limiting our function or our participation in the community and with friends? I mean, like we sort of touched on with like, shameful symptoms and things. If my back hurts, I might tell a friend I can't sit through that 3-hour movie because of my back thing. I don't always say, well, I have a lot of bladder urgency and I might not make it through the movie. Like we don't say that even if that's the thing, right? And so then that limits us being able to connect and to participate and do stuff that we love or that's important. So it's never like, there's never an age or a time that I'm like, well, you missed the window. Like that absolutely is not true. And even if you did something, let's say you had a baby, you did pelvic floor therapy postpartum, you might need to come back to it at a later date. You might have body changes, lifestyle changes, hormonal changes that require, a new treatment plan, right? So I think there's never an age or a time that I think it's too late. And then the second thing to address is kind of your question about Kegels. I know because we have talked about this, that I am just so not a fan of that being the only advice, for multiple reasons. A big one is that in the literature, if you look at the evidence of research that's been done testing people on doing a Kegel exercise, what that is a pelvic floor muscle contraction. So basically they ask people, they're manually palpating, so they're feeling for a pelvic floor muscle contraction, asking them to perform one, and it's something like only 50% of people even do it right. So, a lot of times, like when I go through my model, women don't even understand how many layers of muscles we have, how many different types of muscles we have. So to me, it's kind of like, well, what are we doing? 50% of people don't even do this contraction correctly. There's a lot of ways to do this or to apply it. And there's certainly conditions like particularly urinary urgency or urge incontinence when we leak because we're urgent, or pelvic pain, where Kegels are blatantly going to make your symptoms worse. So that's why it's like that being the only thing that people really know or associate with pelvic floor bothers me so much, because it might help you if it's the right treatment for you and you can do them correctly. Half people already don't. And for a lot of people with different symptoms, it's probably the wrong treatment for you. And so it's like, we're taking multiple different muscles, multiple different groups and layers, and putting them all into one exercise that was like on a pamphlet about, doing it sitting in your car at the stoplight, which is not where we're leaking. So it's it's just not very functional. Like if we're going to work on a Kegel, let's make sure you're doing it right. Let's make sure you can time that Kegel, like when you need to with a sneeze or a cough, let's make sure those muscles initiate rapidly. Let's make sure the rest of your core muscles are all doing their job, because if a pelvic floor is overactive and it's doing everything, and maybe abdominals or low back are not performing well, or our diaphragm, our breathing muscle isn't performing correctly, then that poor pelvic floor is doing so much. And now we're trying to squeeze it. It's not going to solve the problem. And that's why I think for a lot of people, it didn't solve the problem. And I hear that, numerous times where people come in and tell me like, well, I tried Kegels before, it never really helped. And they're kind of like, so what do you have to offer me, And I'm like, well, we're going to do something totally different. And at the least, if you need Kegels, if we decide that needs to be part of your treatment plan, then we're going to make sure you can do it the right way, the right time, and all of those things.
Yeah, absolutely. And just showing us the model shows right there that it's more complex than a Kegel. Totally. One muscle, like one contraction cannot fix all. Like, it's 100%. Just,
and it feels different to contract the front of my pelvic floor, like kind of around the urethra, than it does to contract at anal sphincter muscles around the rectum. Those are different muscles that feel different to contract, which is different than doing a lift with my deep pelvic floor muscles. All of that feels different and may be needed at different times. If I'm lifting a heavy box and I don't want to leak, or I have a pelvic organ prolapse I'm trying to protect, I need those deep muscles doing their job. Versus if I am in an elevator and I'm trying to hold back gas, right? I don't need to lift, but I do need a strong anal sphincter squeeze. Yeah. So it's really important that it's not all just kind of one thing. We should be able to utilize these muscles just like any other muscles in our body in a very specialized way. Very specific, I should say.
Yeah. And I think that's where my mind is going right now, Hannah, is that, okay, so I'm someone watching this and I'm like, what? Kegels is not what I'm supposed to be doing. So how do I prevent this happening from me? Or how do I make my pelvic floor, whether it's more relaxed or stronger or whatever the term is? You tell me, like, what is it that we should be trying to go towards to help our pelvic floor? Because there's so many sitting jobs these days, and that's
Totally.
not the only time we're going to hurt ourselves. Right now we're being told to lift heavy, and we've got women out there who maybe aren't strong enough to be doing that, and doing these deep squats or what have you. So
Right.
yeah, give us some advice on what should we be doing, and I understand that it's very complex, so you may not be able
Totally.
to just say one thing.
Totally. It's always a case by case basis. But let's assume that there's not maybe underlying dysfunction. We're just looking for general wellness.
Yes.
Right. I think the first and most important relationship is understanding how our pelvic floor muscles work with our diaphragm. So our diaphragm is our main breathing muscle, but it is a skeletal muscle, which means we can move it. We have voluntary control. And so it is sort of the lid on top of my trunk, with abdominals and back muscles wrapping around like a pop can, and the bottom is my pelvic floor. And so my diaphragm and pelvic floor work together. When my diaphragm contracts, when I breathe in, it does this, it comes down, which means my pelvic floor muscles should also drop to accommodate that movement. And so when I exhale, then they should all lift. And so a very simple but safe for every single human being, no matter what symptoms you have or not, a very safe exercise is practicing moving your diaphragm. And then I like adding kind of a kinesthetic awareness of trying to feel your pelvic floor. Because a lot of us don't, this is the first time you maybe saw your pelvic floor. So you've never tried to feel it within your own body and develop that kind of awareness. And so first, can we just get diaphragm to move? Can I breathe in and feel my lower ribs and my belly expand versus lifting up at my chest, which doesn't move my diaphragm? Once I can feel that, then can I feel my pelvic floor muscles push down a little, drop down a little, right? As I breathe in, so that I'm getting that up, down coordinated movement. That alone is already so protective for us, because it's establishing normal range of motion in the pelvic floor muscles. It's establishing a coordination with our other core muscles, right? This is 25%, but we want to bring the other core muscles on. And of course, it's relaxing. It's good for our nervous system in other ways as well, which for other pelvic floor things and for pain in general is helpful. So that would be like my number one thing. And my number kind of two general would be work on general core strength, right? Like, can we do a plank, or can we hold ourselves in a hands and knees position and maintain a stable neutral spine? Working on general core is going to help so much. If I'm sitting all day and maybe having pelvic floor dysfunction, and now I'm just trying to Kegel without working on my abs or my glutes or my back muscles, I'm missing all these other muscles that have also kind of gotten lazy from me sitting in a supported surface, and they don't have to do their job all day, right? So I think diaphragm breathing is a number one must do that's helpful for everybody. And then general core strengthening is always going to be helpful, and increasing activity. My other kind of joke here is always sex is a workout for our pelvic floor muscles, right? And so engaging, even it doesn't have to be even with a partner, right? But some kind of sexual activity is a workout for your pelvic floor in a very good way. It's part of its functioning. It's part of what it's supposed to do. And it helps bring a lot of blood flow to the pelvis. It helps the muscles do their normal functioning. So, I mean, bonus points, there's a great extracurricular activity we can do if you're safe, if it works for you, if that's your thing, to keep your pelvic floor healthy. So I think those would be kind of my general threes.
Love that.
I love making the connection with, or you talking about the diaphragmatic breathing, because we talk about that, as, in our worlds of, talking, with our clients and bringing new holistic therapies to people. Breathing's at the top of the list, right? It's something we can control and learn quite easily. And to make the connection with the pelvic floor is even talk about a bonus point. It's not only deregulate, calming the nervous system, it also can get you in touch with your pelvic floor a little bit more than
Totally.
maybe you are. So that's
And
great. I
I
love
said for
that.
things like pain, for urgency of urination, for constipation, those are probably the top three things that I see, or incontinence related to urgency. Those are the top things I see more in the middle age group. And so those are all improved by calming that sympathetic, that fight, flight, freeze part of our nervous system. And diaphragm breathing is such a great tool to do that, to reactivate our parasympathetic, our rest, digest, relax functioning, and those things that my pelvic floor do, right? Bowel, bladder, sexual functioning, those are rest and digest mode. Those are not, I'm being chased by a lion mode, right? That's not the time to stop and have a bowel movement or have intercourse or deep breathe, right? I'm not going to do those things. So if I'm purposefully deep breathing, I'm sending the message to my nervous system to let my muscles relax, to improve, motility through my GI tract and things like that. It's sending the right message to our nervous system.
Yeah.
Yeah.
And
Awesome.
I love everything you said. And I don't know if everyone else is doing this, but I am low belly breathing as we're talking about it. So I'm wondering if you could just take like 30 seconds, 15 seconds, whatever it is, and just how you would talk somebody through doing that. Could you?
Sure.
Just because, some people are going to be like, I think it'd be really good for people to just sit here and practice it with you guiding it. That'd be fantastic.
Totally. I will say I am a manual therapist, and so I do a lot of teaching with my hands. So it's always hard when I can't put my hands on a body.
Sure.
But here's a common mistake that I see is with the term belly breathing. While we know that means breathing with your diaphragm, a lot of folks, and tell me if you can't really see me, but a lot of folks will just push their belly out, right? They make their belly kind of hard, and that's not using our diaphragm.
Right.
And so I like having people either put their hands kind of on their ribs, but on the side, or one hand on the rib and one on the chest. So if they are a big chest breather, I usually do this because I want this hand to be quiet. So as I breathe in, can I fill that rib cage hand with my chest moving just a little. And as I'm doing this, now I'm feeling in that rib cage hands. Can I fill that lower rib cage with air? And I prefer that to the belly because our diaphragm, like our pelvic floor, is three-dimensional. It's going all the way around. And so the side and back of that diaphragm should move just as much as the front. And so if you're doing rib cage hands, it's going to be here, and we're breathing in and filling those hands. The other mistake I see is people go too fast. They'll be like, I'm out of breath practicing my breathing, right? So if you're struggling to feel it, then just slow down. Use a count. So breathe in through the nose for 3 to 4 seconds, out through the mouth for 3 to 4 seconds. And just like any other skeletal muscle in our body, as we practice, warm up, and tune in, it gets easier, right? So as I practice that, maybe the first minute, I can only breathe in for a couple of seconds. But as I practice and I go slow and I feel those ribs moving, then I start getting deeper. And by minute 5, now I'm breathing in with 5, 6 seconds in, 5, 6 seconds out, because that muscle got warmed up. So if at first you don't quite feel it or feel all of it, that's okay. It's a practice, and it takes warm up to get those muscles moving to their fullest potential. So really use that full time. I usually give a minimum of 5 minutes, sometimes up to 10, of just practicing the breathing. It's funny because like a lot of people, I can give you 10 exercises to do and they'll do all of them. but I ask you to relax and sit down in a comfy position for 5 minutes and breathe. And they're like, I don't have time for that. Right.
So true.
We do, of course, have time for it. And it's one of the best practices you can take. I still do diaphragm breathing myself as part of a meditative practice. And, I spend usually 15 minutes or so, 5 times a week if I can. Weekends, sometimes things get crazy, but it is the best part of my day sometimes, because it just takes a second to step back and relax and feel your body doing that movement. And it just sets a tone to allow our body to get, again, to that rest, digest, relax state. So that's kind of the best teaching I can give without having my hands on a body.
That's great.
Sometimes
that was great.
Do different things.
Yeah.
But
Thank you. That's
Perfect.
awesome. I think, Hannah, one of the most valuable things that you've done in our class, that when you've come to as a guest to the menopause education class, is talk about what women should expect at a pelvic floor therapy visit. I think I've gotten great feedback from people, and I think our viewers would really benefit from just a quick explanation. I know you go through it much.
Totally.
At a lengthy explanation when in office, but I just think it's a great thing for people to know.
Yeah, I totally agree, because I definitely can say people come in sometimes and they were just told to come here and they don't really even know what I'm about. And because it is a more intimate exam, sometimes a little forewarning is nice for folks.
Yeah.
So certainly for whatever reason you're here, there's lengthy screening. So I like to go through all bladder, bowel, sexual function complaints, any back pain, hip pain, delivery history, any of that, surgical history, because all of that plays a role. And so we kind of go through all of that first. Physical exam is going to look at your trunk muscles, your hip muscles, your general range of motion, how you move, depending on the person, sometimes some balance and other functional movements. But for pelvic floor specific, I do an internal exam. That typically is vaginally. If you have a vagina, it can be rectally. If that's what we're working with, that's fine. The purpose of this is to really identify what's happening with the pelvic floor. Because like we talked about, if you prescribe the wrong thing for, a pelvic floor that's not doing what you kind of are thinking it is, you can make something worse. So it's very important. I tell people, just like if you come to me with shoulder pain and I didn't touch your shoulder or feel what it's doing, and I just start giving you advice, it might work, it might not, right? So the internal exam really allows me to feel exactly what your pelvic floor muscles are doing, exactly what maybe Kegeling or bearing down means to you. So it's what is your body doing? So what that looks like is I leave the room, I ask you to undress from the waist down, and you'll have a sheet to cover yourself. When I come back in, with a gloved hand, you're going to feel just external pressure first. So I'm assessing that more superficial muscle. If there is a history of tearing or episiotomy, I want to feel for that scar tissue too. And I'm just getting an assessment of generally what's your pelvic floor doing? What's its resting position? So what does it look like at rest? You feel me separate the labia. I ask you to bear down once or twice. So I'm looking for your range of motion. If there's any concern for pelvic organ prolapse, we're screening for that. Then with a glove lubricated finger, I insert vaginally. You're going to feel me press down and diagonal. I'm feeling the more superficial muscles again. Also, if there's scar tissue remnants, I want to feel for that. If we're here for pain, I want to know what it feels like. Is this triggering for your pain at this muscle level? Then you'll feel me insert up to the third knuckle. So through the vaginal canal, you can feel all of those deep pelvic floor muscles all the way around. So our vaginal canal is kind of mucosal tissue like the inside of the mouth. So you can press on it and feel what's on the other side. So we're getting an idea, a mental map, basically, of what your muscles feel like. Are they symmetrical on both sides? Is there too much tightness or tone on one side or the other? Are there trigger points for pain? Then you feel me bring my finger back to center. So now I have you squeeze using your pelvic floor. I try to cue very little. I just want to feel what you naturally do, because it can be all over the place, to be honest. And then I usually have told somebody about the diaphragm breath, but now I'm just feeling what, again, without coaching, what do you do naturally? Can we feel the pelvic floor as you breathe in? Do a drop. Because if not, there's already a problem with coordination for our core control, right? So that's really what I'm feeling for. And kind of based on all that, then I let you get dressed and we talk about like, here's the findings, here's the things we need to work on. What's the best treatment plan for you? Often that does include further internal treatment, whether to cue the pelvic floor muscles, to stretch the muscles, to coach a proper contraction or diaphragm breath. But that, again, is all dependent on the person. So that's sort of what the exam looks like and kind of what to expect.
That's great. So important.
Yeah, very important, because a lot of people won't go for that reason, right? And to understand that, I think that's super helpful.
And I always tell you, it takes me like longer to explain it than to do it.
Didn't do it,
yeah. Bad. I've had it done to me. Like, it's not that bad. I think it's friendlier, frankly, than if you're a woman and you've had speculum exams. It's friendlier than that, and it's really like, it's important also to me that you have an idea. One of the things I think sometimes that happens with a little white coat syndrome, right, is like, I don't know what they're testing for. I don't know what they're doing. I try to really coach to like, what I'm feeling for. You start to feel it in your own body so that you can take ownership of your pelvic floor because it belongs in your body, and so I think that's really important too. I guess the other thing to add is it's certainly fine with me if you are more comfortable bringing someone, a spouse, a partner, a friend. That's fine. I have had women do that in the past. Not everybody, feels that need, but certainly if there's something in your history that you want someone with you, that is absolutely fine. So always too, if you're seeing a pelvic floor practitioner and you're nervous about that part, you would feel better with a spouse there or a friend or whatever, or mom, or daughter, do that. That's okay. This is your appointment. It's for you. And so we want to get you as comfortable as you can.
Well, I mean, all of this is so amazing, so much information, and I'm sure everyone's like, I want her to be my pelvic floor therapist. So do this. Tell us, where that people can find you if they're in your area, but also, since we know that this is, more than just Illinois and the local area, if you could give some information and some advice on if someone needs a pelvic floor therapist, what they should look for, or if it's a certain credential, certain schooling, what they should, what questions they should ask.
Yeah, totally. So I am at B Health in Oak Park. So we're at 1010 Lake Street. We are in Suite 400. And so that's where you can find me. If you're not in Oak Park, totally fine. I am trained through Herman and Wallace Pelvic Institute. They have a website with practitioners where you can look up in your area. So I think that's a great resource. The APTA, the American Physical Therapy Association, they also have a pelvic health special group through them. And so they have it also on their website where you can look up and find practitioners. Those are the two that I am the most familiar with and I set the most store by. And so if you're looking for a practitioner, I think one trained by either of those parties is at least, from my knowledge and from my training, would be similar to kind of what I know. Not that there aren't other ones that are great out there, but those are kind of the two big names that might be helpful. Sure. So I think that's always something to look for. And then I also think it's good if you think you found someone, or you even just Googled pelvic floor PT and someone popped up, call, ask some questions, right? Do they do internal exams? Is it a one-on-one appointment? Do you have private treatment rooms? That's why I work here. I have all of those things, and that's essential for me to do my job well. And so somewhere where they don't have that or they don't offer that, I think that's a big, important thing to know right off the bat. And especially because you've heard me explain it, why I think it's so important to have an internal exam and to properly assess the pelvic floor along with the rest of your movement. If someone's not really doing that, but saying they do pelvic floor and then they just prescribed you Kegels or hooked you up to like a biofeedback machine, which could be a helpful treatment. But if that's all that you're getting, then in my opinion, you're not truly getting the specialty of pelvic floor and what pelvic floor PTs can really offer you. And so those are kind of questions or sort of screening things that I would want to know if I was trying to find a practitioner for, a family member out of state or something like that.
Yeah,
great.
That's
Thank
great.
you.
Two additional things I'd like to say about B Health is if you're not in the Chicagoland area, Oak Park is just 9 miles west of Chicago. Just want to let you know where Oak Park, Illinois is on the map. And then also I think another really special thing about Be Health in your practice is that all of your rooms are private, not only for pelvic floor,
Totally. Yes.
but for all orthopedic PT. They're all private rooms. And I just think that's really special and can be so beneficial to patients, especially people
Totally.
that are nervous or scared. I just think it's a great thing that about Be Health. Another great thing about Be Health.
We think so too. Thanks.
Yeah. All right. So if Dr. Hannah, what would you say one thing, number one takeaway for our viewers today about pelvic floor? We've covered so much. It's been so informative.
Amazing.
Great.
Yeah, it's been amazing. Did we leave anything out? Do we need to say anything else?
I don't think so. I mean, I could talk forever about this. I get very excited. I think the two things is just movement is medicine, right? Don't stop moving. It's never too late to start moving. Our bodies are made to move. And so movement is medicine for our bodies. And then don't put off, symptoms that are bothersome to you. Don't ignore them. You don't have to live with it. I think women in particular are really just taught that message. Like, that's just part of being a woman. Just live with it. Oh, you have cramps so bad you can't get out of bed. That's just part of it. No, it's not. It's not. And we don't have to live with it, and we shouldn't live with it. And so don't just live with symptoms that are bothersome to you. Whatever it takes, whether it's PT or something different, address it, because you're worth addressing it.
Wow, that is a perfect ending to that. Oh my gosh, if that's like our motto, Dr. Hannah, like with what Angie and I do and who we work with, it's just, come on, like, we deserve to feel better at this time in our life, and whatever it is that's in the way, there is a solution. And don't take no for an answer. Totally. So I appreciate that. So yeah, thank you. Like Angie said, super informative. I love that. I think we hit just about everything. And I know our audience is going to find it super useful. I want to just say also that you said movement is medicine. That's a perfect segue to our next episode, which we are having another fellow nurse coach on, and she tackles menopause with movement, which I think is just such a great little segue. So just want to thank you and thank everyone for watching. Those that are watching, don't forget to subscribe, hit that button for us so that you don't miss these future episodes. So thank you again, Dr. Hannah. This is amazing.
Totally my pleasure. Thanks for having me.
Yeah.
Thank you.
Thanks.
All right, Dr. Hannah. So this is where we do our lightning round or our rapid fire. It's just a bunch of several fun questions. Just first thing that comes to your head, you answer. Okay.
No problem.
All right. So coffee or tea?
Oh, coffee.
Cookie or cake?
Oh, probably cookie.
Cookie. Dogs or cats?
Dogs.
Me too. Comedy or horror?
Comedy.
Nice. Me too.
I don't need horror. I'm going to bed tonight. I can't have nightmares.
Amen. All right. So what's your favorite self-care practice?
Honestly, I do a meditation practice about 15 minutes. I take a train for work, so I do it on the train home almost every weeknight, and it's like such a great way to end my day. So that, I think, is definitely my favorite.
Love that. I'm not sure about closing your eyes on the train, but
what's funny is I find actually, I'll do it with an earphone, and I set an alarm just in case I fall asleep. I don't want to miss my stop. But there's something very nice and rhythmic with the train and with the movement of people on and off, but that doesn't concern me. So it sort of keeps you like I can stay very relaxed and focus on the meditation without being too relaxed on my couch falling asleep. It's kind of nice.
Yeah, makes sense.
That's a good point. Yeah.
All right, got two more. What's your favorite go-to quick energy boost other than coffee?
Oh, right now it's endurance training for my triathlon. So It's like I feel more energized after my, hour in the pool or whatever it is. Like those endorphins are real.
Yeah, absolutely.
Good job.
All right. Well, since we are a midlife YouTube channel, and that's who Angie and I focus on, and I know, Dr. Hannah, that you are not there yet. Can you tell us what you're looking forward to about midlife?
Yeah. I I actually think aging is awesome. Every time I turn a new age, I'm like, oh, I've never been this age before. Like, what is this going to bring? So I think like the things I've heard that make me excited for midlife is, some security in, you've been in your career if you're working, right? And that's, something that you've already sort of gotten yourself very established, right? And that's something that feels really good. I think you have a strong sense of identity. You know who you are, at that point, and you've established hopefully some lifelong friendships, and met a lot of goals of things you wanted to accomplish too so far.
Yeah.
So I think that's all like super exciting to look forward to, and hopefully have a little bit security of like what's coming next, where do I go next in the second phase of life, because like I said, each year is a year we haven't been yet, so I think that makes me excited.
It's a great way to look at it. I love that. Well, thanks for enduring our lightning round, and best of luck on that triathlon. That's amazing.
Yeah.
Thanks, I'm
Can't wait to hear
excited.
about it.
Yeah. All right, take care.